Good evening, friends. Today I'm going to explain the radiology of lower limb. Listen very carefully. As we discussed previous class, the radiology of upper limb. Here the same type, that is plain type you can say, as there is no radio opaque dye used here. If radio opaque dye is used, it may be a contrast type. So here there is no radio opaque dye used. It is plain type and AP view, that is anterior-posterior view, and the region here you must say is bilateral hip joint with bony pelvis, because bilateral hip joint. First X-ray, that is radiology of hip joint. Here listen very carefully. What are the bones appreciated? The first is femur, hip bone. This is hip bone. This is femur, and this is sacrum, and this is coccyx. And here you can see the pubic symphysis, which is joined by the fibrocartilage further, and pubic symphysis is secondary cartilage joint. Here, coming to the joints, you can see the femur articulate, head of the femur articulate with the acetabulum to form hip joint, which is a ball and socket type of synovial joint. And coming to the, here you can see the sacrum, right? This is sacrum and this is ilium bone. So the joint is a sacroiliac joint, which is plain type. And coming to the another appreciating feature is lower lumbar vertebra. Lower lumbar vertebra you can see here, and you can also see the intervertebral joint, which is secondary cartilage joint. And coming to the, this is also same type. This X-ray and these are both same. So in one X-ray only I will explain everything. So coming to the femur. Femur you can see the head, which is round, and you can see the neck, and you can see the two trochanters, greater trochanter and lesser trochanter. Okay, these both are connected by the intertrochanteric ridge. You can appreciate here. This is a intertrochanteric ridge. This is greater trochanter, lesser trochanter. This is a intertrochanteric ridge. And the neck, and this is shaft. Shaft and the neck is connected here. This angle is called neck shaft angle. Okay, this angle is 125 degree in adults and 140 degree in children. In adults it is more in female. Okay, now coming to the femur, here you can see a thick line here, ridge, which is present in front of the lesser trochanter. This is called calcar femoral. This ridge is called calcar femoral. What is the role of this? This transmits the weight of the body from the head to the neck, that is linea aspera. And another is from the greater trochanter till the head, the upper border of the neck, there is a ridge, another ridge called as a cervical torus. Okay, this is about the features and parts of the femur. Now coming to the hip bone. Hip bone, there are three parts: ilium, ischium, and pubis. Okay, here coming to the ilium bone, you can see the iliac crest here. Here you can see iliac crest. Okay, and this part is called anterior superior iliac spine. This part is called anterior inferior iliac spine, and if you go posterior, this is called posterior superior iliac spine, and this is posterior inferior iliac spine. Okay, and you can appreciate here, if you see, this part is called ischial spine, where the pin structures passes. Okay, now coming to the pubic bone. Pubic bone, you can see the pubic symphysis, and this is the pubic wall. Okay, pubic wall. This pubic wall is formed. Pubic wall is antero-inferiorly. Okay, position, and it contains body. Pubic wall contains body and the superior ramus and inferior ramus of the pubis. This is obturator foramen. Okay, coming to the ischium. Ischium, this is the body of ischium, and this is the ramus of ischium. The ramus of ischium and the ramus of the pubis join to form the conjoint ischiopubic ramus. Important. Conjoint ischiopubic ramus. Now, coming to the lines, there are three lines that will be asked for the viva. First line is called Shenton's line. Shenton, Shenton's line. Okay, this line arises from the superior border of the obturator foramen and joins the inferior border or the lower border of the neck of the femur. Here, this is Shenton's line. This line should be continuous. This line should be continuous for the normal people. If it is not continuous, if it is like this, then there will be a dislocation of the hip joint. That indicates the dislocation of the hip joint. Now, next line is Variant's line, that is Vyant, Variant's line. This line, if you take a vertical level from the greater trochanter and vertical level from the greater trochanter and a horizontal level from the anterior superior iliac spine, this length should be around 5 centimeter in normal individuals. If it is altered, then it says the indication of hip dislocation or hip joint dislocation. Okay, now hip joint dislocation, that is unilateral or bilateral. Next line is Nellant's line. Nellant's line. Nellant's line. This is if we join the anterior superior iliac spine and ischial tuberosity. This line is called Nellant's line. This line, from this line, the highest point of the greater trochanter will be present at that line. If the greater trochanter is above or below it, it indicates the dislocation of hip joint dislocation. Okay. Now this is about the hip bone X-ray. Same you can say in this also. This is the region of the femur, thigh region. Thigh region. Okay. Here you can see the greater trochanter, lesser trochanter, neck of the femur, shaft of the femur. Here you can see the condyles. Okay, and this is also, here you can see the fracture of the shaft of the femur. Okay, this makes the hip joint dislocation. Now coming to the knee joint X-ray. Okay, here you can see the, what are the features you can see. Here you can see the lower part of the femur, okay, and the lower part of the femur and the upper part of the tibia, upper part of the fibula. And appreciate here, very important. Here you can see somewhat white structure, white depression here. This is the impression for the patella. Okay, impression for the patella. So now coming to the joints. Here you can see the knee joint, which is a bicondylar variety of synovial joint. It is also a modified hinge joint. And next here you can see the superior tibiofibular joint, which is a plain type of synovial joint. And you can see here that is a patellofemoral joint, that is saddle type. Now coming to the femur, here tibia is articulating. So this is a medial condyle, and this is medial epicondyle of the femur, and this is a medial supracondylar ridge. Similarly here lateral condyle, lateral supracondyle, lateral condyle, lateral epicondyle, and lateral supracondylar ridge. And similarly in the tibia, if you see the, you can see the medial condyle. This is medial condyle, lateral condyle, and intercondylar area, where intercondylar tubercle will be present. That you can see the attachment from anterior to posterior, Medical College, Lucknow Medical College, cruciate ligaments and menisci. In the gross anatomy, you can study that, and it is very important. They will ask the viva questions. Now coming to the fibula. Fibula, you can appreciate here the the fibula. This is head of the fibula, neck, and the shaft of the fibula. This is the lateral view. This is AP. In the lateral view, you can see the patella, femur, tibia, fibula, and here this bony nodule, very important. It is called fabella. This is sesamoid bone developed from the lateral head of gastrocnemius. Lateral head of gastrocnemius muscle. Okay. This is also patella, femur, fibula, tibia. Here you can see the AP view, right side, femur, impression for the patella. You can see the medial condyle, lateral condyle, intercondylar ridge, intercondylar area, intercondylar tubercles. Here you see, and you can see the fibula, and this is patella. In this lateral view, you can appreciate the lower end of the femur, two condyles overlap, and the patella, and you can see the tibia, two condyles overlapping here, and this is fibula, and here you can see this elevation. From here elevation, this is called tibial tuberosity. Okay, now if you come to the next x-ray, same you can this is AP and lateral. You can see the tibia, fibula, same lateral view patella, and this is a fracture. Here you can see multiple fractures of tibia, and also in the femur also there is a multiple fracture, I think. And internal fixation done by using the plates and the screws. These are internal fixation by using plates and screws. Locking compression plate. Here there is a fracture of the fibula, and same the plates have been used for the heel purpose. Now here also there is a fracture of tibia and the fibula, tibia lateral view fracture. Coming to the foot, okay, here you can see great toe. This is little toe. Here you can see the medial side, you can see the thallus bone. Here you can see the calcaneum. This is AP, and in front of thallus you can see navicular bone. In front of that you can see medial, intermediate and lateral cuneiform. And here you can see the calcaneum lateral side, and this is a cuboid in front of calcaneum. And the joint between the thallus and calcaneum is called subthalar joint. It is a plane type. And joint between the lower end of the tibia and the calcaneum, lower end of tibia and thallus, lower end of tibia and thallus is called ankle joint, hinge type of synovial joint. And this is medial malleolus, this is lateral malleolus of fibula, this is of tibia. And between them, between these two, there is a joint called the tibiofibular joint. Okay. And as we saw here, fibula, here we saw fibula, sesamoid bone. Similarly, bony nodule it was. Similarly, you can see in the foot also two bony nodule in front, near the near the metatarsals, near the metatarsal, first metatarsal, that is called sesamoid bone. And coming to the lateral view, here you can see same calcaneum, thallus. This is navicular, boat shape navicular, cuneiform. In front of calcaneum you can see cuboid. Here there is a multiple fracture here, multiple fractures of phalanges and metatarsal bones. And here you can see between the calcaneum, thallus and navicular there is a joint, thalocalcaneo-navicular joint. This is a ball and socket type of synovial joint. And between the calcaneum and cuboid there is cubocalcaneum joint, which is saddle type. And rest all intertarsal and intermetatarsal joints are plane type. And tarsometatarsal, here metatarsal and tarsal, these joints are plane type. And metatarsal phalangeal joint is ellipsoid, and between the phalanges is hinge joint. Interphalangeal joint is hinge type of joint. Here same you can see this lateral view. This is you can see calcaneum, in front of that cuboid. Here thallus, naviculum, and medial, intermediate and lateral cuneiform. Okay, and you can see, appreciate here the metatarsal phalanges. Okay, here you can see the fracture of which metatarsal they have been fractured. At last you can see this same pelvis x-ray, that is AP. Here they have written right side, but here they have written RGU, that is a retrograde urethrogram. It is an they retrograde urethrogram, they inject it with the radiopaque dye, so that they can see the narrowing of the urethra. Okay, this is the clinical point. So in next class I'll be discussing about the radiology of thorax. Hope you understood the radiology of lower limb. Thank you.